forgotten about, seldom talked about. Look like we just forgot about them. Or do we close our eyes and act like we don't see them? As some walk aimlessly through the streets, they're the ones who fell through the cracks as local and national government pushed them back. Not on the inside, but the outside, as they continue to lie and close their eyes and deny them.
Good afternoon. My name is Carl Populus, better known as CP in the neighborhood and throughout. Today I'm very excited. I got two guests that I've been trying to catch ever since my first show. If you look back at the first show, you remember that I did mention that I was supposed to have been doubling up on the Dr. Smith, but I missed him, but I got him now, and I'm going to take the advantage of it in a real good way. As you know, this is a 21st Century Focus Group Up to the Minute, and today we'll be talking about the destruction and privatization of the King Drew Medical Center. And without further ado, I would like to go right into my guests. I would like to introduce on my right here, Dr. Smith, MD, and over here, Dr. Ernest Smith, PhD. So I would like for you to just kind of tell a little bit about what you know here and what the discussion is about today as you know it.
Well, what we want to talk about today is the destruction of the King Drew Medical Center, which includes the Martin Luther King Hospital and the Charles Drew Medical School. And then the plan to privatize it once it has been destroyed, or at least removed from our hands. And I think the thing that is most important is historically, even though that hospital was built because of the 1965 riots, on the recommendation of the McCone Commission, that they really didn't intend to build that hospital. They didn't want to. And they were forced to build it because of the international acclaim that was given to the Watts riot, when people came from all over the world to see what was the reason that they rioted so desperately in Watts. So in order to save face, the government then encouraged that hospital be built. And it was built, I feel, to last for one generation, which means like 30 years. When we first came to that hospital, the first attack I remember was when they had put flyers on automobiles all through Watts and Compton, telling them not to use that nigger hospital and don't let them nigger doctors treat you because they'll kill you. So in other words, that right off the bat, before the hospital even opened, there was an attack made on it. Then over the years, it was a matter of fighting for budget and getting the proper amounts of money to keep it going. And it wasn't until 1989 when the LA Times led the attack. And it was through some articles by Claire Spiegel, who came through Martin Luther King Hospital, and she said, on the invitation of Dr. James Houghton, who at the time was the medical director, and he gave her carte blanche to go through that hospital any way she wanted to go through. And what she did was then take certain things that she thought she saw and twist it, and wrote some of the nastiest articles about King Andrew, which actually could have killed us then, but we were strong. So when they then had JACO come down, which is the Joint Commission for the Accreditation of Hospitals, they had already been at King, gave them a very high rating. When it was recommended that they come back, they came back and could find nothing wrong. And then they went to the group that okays Medicare and Medi-Cal and tried to get them to come back and snatch the money from King, and they could find nothing wrong. So the plan that was kicked off in 1989 did not work. So then they began to undermine King from 1990 on up to about 2002. And they mainly did that by doing what they call cascades, where they would say there's not enough money, and because there's not enough money, then we have to remove people from the hospital. So we would transfer them out to the Valley or to Big County, or we would just simply reduce them from the payroll. But every time that they had a cast roll, then the staff was being shrunk down, and sometimes some of the key people, or some of the good people, were being removed from the hospital. And that culminated until, I guess, about in 2002. And at 2002, the big discussion was between Dr. Thomas Garthwaite, who's now the director of the Department of Health Services, and Supervisor Zev Zaroslavsky. And at that time, they were talking about how to bring their forces together because of the money, and kind of make Big County, it was the major tertiary center, and then having other centers kind of feeding into it. The main thing about that was that King was not to be disturbed, other than the fact that it was to be improved, but Harbor was going to be shortened down to almost being a clinical center. the hospital out in the valley, which one? Olive View was going to be reduced to a clinical center, and Desert was going to kind of just be wiped out. Well, that was what everybody thought. But in the discussion, Zaroslavsky comes out with the idea that there would only be 2 medical schools in the county, and that they would be in charge of the hospitals that were in the county. Those 2 medical schools would be USC and UCLA. So even on mentally, he had obliterated Drew. Well, now this was before any action was being taken or anybody was voting on anything. It was just a matter of discussion and thought planning. They had already annihilated the Drew Medical School. So it lets you know then that whatever was going to come down the pike, that Drew had to go, and more than likely King was going to have to go. It wasn't until about June of 2003 when they had the major cascade, and they walked 500 people out of that hospital on one afternoon.
175 nurses.
And 175 of those 500 were nurses. Now, they had been crying about nursing shortage since 1990, and every year when they have a cascade, we lose nurses. Now, you can't have a hospital without nurses. And the quality of your nurses determine the quality of your hospital, not necessarily the quality of the doctors. So the point was then that as they began to weaken the nursing department, when they had that major cascade in 2003, and they had now talked about budget, Garthwaite came up with $250 million that he found somewhere in a crevice and said now he was able to pump that into the hospital and try to build it back up. You don't find money. You stash money and you steal it. And you give it up when you get caught. Okay? So first of all, we have to understand then that money that should have been going to King over the years had never gotten to King. Stashed somewhere, stolen, whatever it is, we don't know. Okay? But when that money came up, that changed the issue of budget. And the first thing you know, the LA Times then switches, and the agenda now becomes competency. So they begin to talk about the fact that there were some monitors put on patients that didn't work, and nurses had gone to sleep and hadn't done their job. And from that point on, then the issue of competency became the crying card, not budget. And from that, then they started looking at the physicians, and the very first group that they went after was the Department of Surgery. And they destroyed the head of the Department of Surgery, Dr. Fleming, who was a surgeon trained at Walter Reed Hospital with the United States Army in Washington, D.C., very highly trained. And he comes to Los Angeles and has his career dragged through the mud by some man who probably has never practiced medicine. If he did, probably didn't practice it well, and was nowhere in the category or caliber of Dr. Fleming or Dr. Joe Alexander, who preceded him. But the idea that those were 2 black men, highly trained, and they were, you could very easily get them on stereotypes. Now, what they did was they went to the ACGME, which is the accreditation organization for medical education with residents, etc. And they got them to come through and start nitpicking, one department after another. So the first thing you know, the Department of Surgery is dinged for whatever reasons, and Dr. Smith probably can go into that. Then they started getting all the other departments and zinging them. And then the next thing you know, we're losing our accreditation for residency training. Okay? And then the next thing they do is they move from there to looking at the average worker. So they look at the clerks, the janitors, and say they have a culture where, you know how we are as a people, you curse me, I curse you back. Right? You push me, I push you back. Slavery's over. Ain't nobody taking nothing from nobody. That's a culture that comes post-slavery. It's legitimate. Now you walk through and say that that's a culture, so that means if I come in as a white man, I'm gonna push you around, you're supposed to take it. Okay? Now if you don't take it, I'm firing you. So one of the biggest things now is they're getting rid of the janitors, they're getting rid of the clerks, et cetera, et cetera. When it ends up, there'll be no black folk working in that hospital. Okay? And then you can begin to move it towards privatization. If you do that, you don't have to pay nobody no retirement or health care. You can just make a smooth transition. That's where we see the history has gone.
So I think this is a good title when you say destruction and privatization. You first did it. But so I would like to not waste any time. I would like to just go right on into Dr.
Well,
Smith.
to begin with the situation of the residency, loss of the surgery residency. What had happened was there were some residents that didn't have cardiovascular surgery rotations or experience. And Dr. Fleming didn't want to graduate these men knowing that they had never been given a rotation. The attending physician that was in charge of vascular surgery training died. Dr. Delford Williams died, and so these residents never got that training. Dr. Fleming decided that he wanted to hold them back, and he applied from the ACGME, that's Accrediting Council for Graduate Medical Education. He applied for permission to hold these students back because they hadn't had cardiovascular surgery experience. We in the community endorsed that because we don't want him to send people out here that he knows aren't trained. You know, we don't believe in social promotion. They are not qualified. Hold them until they get the experience and they qualify. They aren't going to pass the boards. At the same time, he has no control over the match system by which new residents come into the surgery program. So the match brought some more surgeons on, and he's had 2 here. That gave him more residents than they were entitled to have, and the ACGME used that technicality as a basis for withdrawing the total residency program, you know, revoking the accreditation of the surgery program. But this is because the Department of Health Service refused to hire a vascular surgeon. He had been begging. He had gone to the Drew board, he had gone to the county, asking them, please give me a vascular surgeon. They didn't want to hire a vascular surgeon. One patient actually was brought to King and transferred to LA County USC, where he died, and they laid that on King. He was not in death. He was stabilized and was stable when he got to the LA County USC. Somehow, the next couple of days, that patient died, and that was laid to King Drew. But the ultimate responsibility was Department of Health Services didn't have a vascular surgeon at King Hospital. That's just one example of how the Department of Health Services, 313 North Figueroa, has destroyed that hospital. The loss of the JCO residency, JCO accreditation. The Department of Health Services had day-to-day, hands-on, direct management of the hospital in 2003 when they lost the JCO accreditation. That's the Joint Commission on the Accreditation of Hospital Organizations. That occurred when Fred Leaf, Bill Runke, Bill Luce, Sachi Hamai, and Garthwaite were directly, they had already gotten rid of Willie May, the hospital CEO. They'd already fired Rosemary Higgins, the head nurse. They'd already gotten rid of the COO and all of the top-level administration. They got rid of Dr. Forrest, who was the interim medical director. Okay, all of those people were not there. They were in charge of the day-to-day, hands-on, direct management. These are the incompetents that were supervising the blacks that they removed. So when they had responsibility for the day-to-day, hands-on management of the hospital, they lost their accreditation. Yet the Board of Supervisors acts as if that's no big deal. It was because the Center for Medicare and Medicaid Services, what's called CMS, came out and said, we're not going to pay for this. You had better get somebody in here to manage this because we're not satisfied that this place can be managed by the Department of Health Services. They've totally destroyed this hospital as far as CMS was concerned and threatened to cut off $250 million of funding. Okay? That's when Navigant got in the picture. While DHS was in charge, they had assisting them an organization called Camden and another organization called Linbar that was supposed to help them pass the JCO accreditation. They got fleeced. Okay, they got hoodwinked, bamboozled by Camden and Linbar. They didn't pass accreditation. With all that expert help and the direct hands-on management of DHS, they lost their accreditation. And Navigant now comes in. Well, Navigant, they're headhunters. They come in to fire niggas. They did their job. They did an excellent job because they ain't got no more niggas out there. Okay, they fire niggas left and right, march them out with security guards every day. Okay, so they're doing what they were hired to do. Okay, they were hired to fire niggas, and that's what they're doing. The Baptist healthcare people who came out and helped Navigant evaluate the conditions at King is out of Alabama. Okay, out of Florida. Okay. That organization is headed by the Klan, the Imperial Wizard, and all of them run the Baptist Healthcare Organization. So we know what that's all about. The hospital administrator out there now is hired by the Baptist Healthcare. She worked for Baptist Healthcare before she came there. I'm not downing the sister. I'm just getting you get the frame of what's going on. That this is the destruction of King. Right now, the County of Los Angeles is negotiating with Catholic healthcare charities to take over King Drew. So the privatization will be the transfer of the management and operations of King Drew to the Catholic charities, and the renaming of Martin Luther King Hospital to Cesar Chavez or Benito Juarez or somebody else.
Well, that's why I call this Up to the Minute. As you guys notice, on the opening, I rode in on the motorcycle on the picture because I got the ride for this cost, because I speak on behalf of some of the uninsured people and the underinsured people that would be using this hospital. And Dr. Smith, I heard you once speak of racism sitting in Garthwaite face. So when you say cascading, I look at it as a word cascading, but in my opinion, I see a little racism in there somewhere when you speak about the people that was walked away and the cascading I saw take place, that people ended up in places that they really wasn't needed. So would you care to speak if
the issue of racism in America is being tiptoed around, okay? And it's almost like looking at a negative, right? When you look at the negative, what is going to be the real picture, it looks like it's dark, and what's not going to be the picture is light. But that's not the picture, that's the negative. When you look at the United States, everybody's talking about there's no racism, you're looking at the negative. But when you get to reality, that which is very, very faint, which is the negative, which is racism, is going to be real. It's going to be very prominent. So racism pervades every aspect of America, especially when it deals with African American people. And if you don't believe that, then you should not go to church anymore. Your religion's in vain. And when I'm saying that, I'm saying it seriously enough to say that as well as we teach about the love of Jesus, we need to teach about the hate of racism. They go together. Do you follow what I'm saying? So that means that if Jesus is not dead, then racism is not dead either. And if we get that ingrained in our head, then every time we see something, they have to prove it to us that it's not so. Now, Navigant came up here with this man from Southern Alabama, right?
Wells.
Remember, I almost had to slap him because of his attitude and how he spoke down to that big crowd of black people, like he was on some plantation in Alabama giving out watermelons. And then they go to the Baptist Health Association from Florida, and they come back to the decision that the culture at King Hospital is such that it causes the destruction of the hospital and it needs to be changed. Of course, you from Florida and Alabama, you didn't go along with Rosa Parks either. She had a culture you couldn't swallow. So my point is, why would you come from those cultures where you have people in plantations and mistreated and come to California and expect the same behavior in California and black folks coming out of Watts with 2 riots to act like somebody coming out of Florida that can't even vote? So my point, you see what I'm saying? So you've been set up and everybody buys into the fact that the culture at King is so different that you got to do something to clean up the culture. And my point is, no, what you really mean is the Afro-American California culture in Watts, California, in 2003 is exactly what it was in 1965. They're not going to take that crap from you, and they're going to speak their mind, and you call that a culture that needs to be moved away, then you must be from the Ku Klux Klan.
But Dr. Smith, Dr. Ernest Smith, the PhD, I would like to ask you a question. Any question I ask, if you feel uncomfortable answering, we could just strike that. I'm just sitting here thinking, when they talk about advisory board that was recommended for the community, being on the hospital advisory board, and you had community members on the board, which I see has been reversed. The process in the first place, as I heard Dr. Smith, the MD, said that these people didn't want to give up the money for the hospital anyway, and they didn't. So what happened with the going from recommending the advisory council and people on the board from the community to Ornstein them helping destroy the hospital? Can you give us any kind of light on that in your own words?
The first hospital administrator that came for Navigant was a person by the name of Elliot Cohen. And Elliot Cohen had met with the community, and he was seemingly more sensitive to the community's concerns. And I believe that the recommendation that there be a community advisory board at King Hospital to give some oversight to what the community's concerns and needs were on a hands-on, real-time basis was his recommendation, because he didn't last longer than a New York second. He was replaced by the person that Dr. Smith mentioned a while ago, Hank Wells, became the hospital administrator. That recommendation was made in the context of 1,000 things that they had found wrong at King, okay? They were not egregious things. In fact, if you look at the record of the deaths that occurred or medical misadventures that occurred, they were on the watch of DHS management. These deaths didn't occur before DHS took control of Martin Luther King Hospital on a direct, hands-on, day-to-day basis. You were getting, JACO was giving 95 and better scores at Martin Luther King. Very few citations, and they were minor kinds of things. From 19, you name the year. You can never find where Martin Luther King got less than the 95 score from JACO in all of those years.
So we can say it was 95 on the black hand side.
Yeah.
Right?
Okay?
Okay.
When the blacks were in there, and this was with people that they had selected. The community had made made it known that some of the people that they had there were not selected. At first, when the hospital was built, the community was involved in the selection of the hospital staff and department chairs and directors and things. That was because we wanted people who were culturally and linguistically sensitive to the needs of the community. But that didn't last long at all. They had a whole change in the culture of downtown at DHS that made the people at DHS only want to have blacks that they could rule and reign over. That happened, I would say, at the same time that Claire Spiegel was doing her articles, because the only time there's ever been a Latino hospital director in the county of Los Angeles was when Bill Delgado was the hospital administrator at Martin Luther King. But he happened to be a black Latino, and that didn't suit the Chicano Employees Association. They wanted a white Latino. And when Bill Delgado was removed because of the Claire Spiegel articles, that's when you begin to see the change in the way that the operations of King was headed, because they brought in a guy by the name of Ed Renford to replace Bill Delgado, and he was a lackey of downtown that did whatever they said. He wouldn't do anything without the approval of downtown. He wouldn't go to the toilet without the approval of downtown. And when he got to the toilet, he called there and asked him which hand should he wipe himself with. Okay, that was the kind of Negro that was. So if there was ever any mismanagement at King, the people that was doing the management was selected by the crackers downtown.
But, and Dr. Smith, MD, if I want to phrase this question just right, if I can, would you tell me in your own words, how did King Hospital go from one of the best hospitals, where I heard somebody say that the Army sent their people there to train, to where we are now, from the good process to somebody undoing the process, and how as we as a community, because I didn't see a lot of this stuff when the Billison hearings and a lot of stuff was going on. I see other people speaking about the hospital that actually wasn't up to speed of what was going on. So could you tell me something about that process in your own words and what you
Yeah, see, the biggest part was this. If you have a plan of war, you don't unveil your whole plan to the enemy, right? So you introduce them to a plan that looks like you're coming from here, and as soon as they begin to adjust their fight to you, you move over here. Then they move over here, and as soon as they get adjusted over here, you move over here. So you have them dancing back and forth, always trying to respond to you. They're always on the defense, never on the offense. So what happened was, when they started off with the budget cut, then everybody started looking through their books to find out, did we make any money or didn't we? Mm-hmm. Did we spend the money wisely? That was not even the issue. We thought it was the issue. That was thrown out to deflect us from the real issue. So after the physicians and everybody got through combing the books, then they found out we made more money than you even gave us credit for. And we've been robbed, okay? And then by the time we go nationally crying and whimpering like slaves do, and somebody tell the man that he robbed us, okay? Then one man wrote an article and showed him, yes,
the most profitable hospital in the nation.
You're the most profitable hospital receiving Medicare and Medicaid in the whole United States, and indeed you have been robbed. Then we take that and say, see, but we ain't even talking about that now. We're talking about competence. Okay, that was last year we talked about that. So now we're dealing with competency. The next thing you know, they start raising out names, taking a nurse and say she caused this baby, this person to die because she wasn't looking at the monitor, and the monitor was already defective. Then when that didn't work, you see, then they danced over to another point. You keep dancing behind them, and you come out of shell shock. By the time you get through with your shell shock, the fight is over.
Very well said, and that's up to the minute. Dr. Smith, I think we have about 3 more minutes. I heard you say once something, Dr. Smith, about the gutting of the hospital and how after you gut it so much, it'll be no more good, and therefore they can kind of juggle it like they want to. It's like shaking their red card. You know it's there, but you won't really see it. So can you take us out with that?
We actually made the accusation that that Thomas Garthwaite, the Director of Health Services, was playing 3-card Monte. The Department of Health Services was facing an $800 million shortfall in its budget, and they needed to find some way to address this $800 million shortfall, and they directed Garthwaite to come with a plan. Garthwaite didn't come with a plan. He came with what he called 3 scenarios and told the Board of Supervisors to pick one. Okay, this is playing the red card, that 3-card Monte. Okay, the 3-card Monte was first, as Dr. Smith pointed out, they were going to close Olive View Hospital, not Olive View, High Desert Hospital, and they were going to sell Rancho off and downsize Harbor UCLA to what they call a MAC. It was going to be basically a large outpatient clinic. That was the original plan. And all they were going to do at King Hospital was some efficiency cut, 16% efficiency. He had come with some documents claiming that King was 25% less efficient than all of the other hospitals in the system. And he claimed that that data came from the state auditors. We contacted the state auditors to see where they were getting this data. He said all the data that the state auditors gets come from 313 North Figueroa. We only analyze the data and interpret the data that's sent us. So Garthwaite sends skewed data to the Department of Health Services, to the auditors, and then gets that report back and then claims that this is objective data, that King is 25% less efficient. It was supposed to be an efficiency cuts, then the whole spin became they're all incompetent.
Now there you have it, raw, uncut, and very much up to the minute. So I thank you guys for coming on, and we're going to go right into a live show here because we want to really harbor as much of this information coming from these 2 very distinguished guests as possible. So as I say, there you have it, up to the minute. Thank you guys for being a guest.
Often forgotten about, seldom talked about. Look like we just forgot about them. Or do we close our eyes and act like we don't see them? As some walk aimlessly through the streets, they're the ones who fell through the cracks as local and national government pushed them back. Not only inside, but the outside, as they continue to lie and close their eyes and deny them the rights and privilege afforded to all citizens. And not all of them are winos or drug addicts. Can't vote because they have no address, but continue to pay taxes while health care for them are lax. Their living quarters have no doors except for abandoned building. The reality is, no one truly wants to live like that. But sad to say, some have no choice, and the rest put their survival skills to test. Anywhere where they can lay their head, you can find them under the freeway, alongside of the highway, or just sleeping in a business doorway. Anywhere, on the streets,